This video is about demonstrating empathy using the Recognise, Acknowledge and Validate, or RAV model. Hi, welcome to Consultations for Health, helping you progress in your communication skills to optimise the care of your patients. One approach you could try to demonstrate empathy to your patients is by using the Recognise, Acknowledge and Validate model. Like with all models, this is not a prescriptive way that you must follow or a rigid set of instructions. It's an approach that you may be able to use to integrate into your everyday consultations. So let's work through each of these terms in the RAV model: Recognise, Acknowledge, Validate. We firstly need to recognise that a patient may be having an emotional response to something. We can do this through their non-verbal behaviours and their verbal clues. In most instances, the verbal and non-verbal clues will be subtle, and you will be required to interpret and read between the lines to work out what is really going on for your patient. Once we think we recognise there may be an emotional response in our patient, it is important that we acknowledge that emotional response. Many clinicians struggle with acknowledging emotional responses by patients. All of us are able to recognise them, but it's the acknowledgement that is the first key stage in helping building that all-important therapeutic relationship and rapport. Let's work through an example. You're sitting at work and one of your close friends comes in and you look up and their eyes look red and puffy and you think they may have been crying. By doing that, you've recognised something may be going on. Therefore, verbally, you would acknowledge that with something like, "Oh, your eyes look a bit red. Are you okay?" Once we have verbally acknowledged their emotional response, we are then trying to find out what's been happening. So you'd usually gather some more information. The final stage is then validating that you understand while they have had that emotional response. It doesn't mean you agree with them, but actually you can see why they may have had that response. This requires the skills of acceptance and sensitivity and the ability to paraphrase or reflect what the patient has told you to demonstrate your empathy. According to C. Abel at UEA, recognising, acknowledging and validating a person's own personal perspective can have a therapeutic effect in its own right. Patients will feel that their own particular situation and problems have been recognised, understood and given due importance. This can increase their self-worth and ultimately make them feel better. At its core, the purpose of empathy is to make patients feel less bad, and this can be achieved by recognising, acknowledging and validating someone's feelings. Demonstrating empathy is a skill much like any other. It can be practiced, honed and further developed. Provided you have the right attitude within your consultations, you can improve on all the skills needed to have a successful therapeutic relationship and build rapport with your patients. In this video, we have introduced the concept of demonstrating empathy by using the RAV model: Recognise, Acknowledge, Validate. This involves a whole range of communication skills and behaviours which you can explore in some of the other videos on Consultations for Health. It's a complex topic, so look out for future videos that will explain things in more detail. I'd just like to take this opportunity to acknowledge the role of the Consultations Skills Team at Norwich Medical School, who have helped us and provided us with important resources for these videos. Thank you for watching Consultations for Health. Don't forget to follow us on Twitter, like our Facebook page and subscribe to these videos.